Yes, we shall discuss briefly approximate teaching plan after August 22nd SMBT. I have already submitted 84 hours teaching plan. That is most important. So what exactly we are doing after 84 hours? So our target is solving previous year's MUHS question papers. So what I will do, I will select important questions and I will tell students to write long answer, short answer, and of course multiple choice questions, because multiple choice questions need frequent revision, because usually MUHS asks these questions for 20 marks. So what I will do, I will follow MUHS pattern and I will solve long answer questions. Then in long answer questions, I will make student to improve the presentation skills, because in long answer question, that is LAQ, most of the students do not write introduction. Usually in MUHS, LAQ is asked under certain headings. For example, describe artery or nerve under certain headings, like describe nerve as under course relation, branches, applied anatomy. Okay, usually 3 and 4 marks are allotted to that. So this is distribution for LAQ, 3 plus 3 plus 4. But what I will follow, I will make student to write introduction, and introduction should be of their own. And most important, students should not write definition in the introduction, because most of the time students write definition in the introduction. Introduction should be from within and how much they have grasped the subject. That is the most important purpose of introduction in LAQ. Of course, there are two LAQs for 10 marks. So what I will do, first of all, I will solve long answer questions which are asked for MUHS in previous year's question papers, in of course addition to parallel long answer question. For example, if they have asked glossopharyngeal nerve, vagus nerve, then I shall definitely cover glossopharyngeal nerve, vagus nerve, but I will also cover hypoglossal nerve. I shall also try to cover spinal accessory nerve. Now we will set the priorities. Now, what are priorities? Usually, eye and ear. I am repeating, eye and ear in HFN has less important. So, what is important? Muscles of mastication, mandibular nerve. I should say rather trigeminal nerve, temporomandibular joint, tongue, pharynx, larynx. So these topics I shall focus as far as gross anatomy is concerned. And as I said, I shall give them prosection, not dissection. So this is after 84 hours my theory teaching plan. Now about practical teaching plan, I have already submitted. Now brief to discuss about SAQ and LAQ, SAQ and MCQ. Now as far as SAQ are concerned, usually they ask small SAQ like histology of salivary gland or histology of spleen. So students are expected to write what they see, highlights in the slide. In SAQ we don't expect much details, so SAQ should be point wise. And for MCQ, yes, this is most difficult, they should know specific answer. So what is my plan in teaching MCQ? I try from theory to MCQ, not from MCQ to theory. First, I cover particular part. For example, I cover submandibular region or I cover submental region. Then I will ask them the question on submental region. For example, following muscle forms the boundary of submental triangle. Then I will give the option. I shall give the option that is trapezius, anterior belly of digastric, and so on. So they have to choose the correct option, the best option. So this is a tentative teaching plan I'm going to follow after 84 hours. I have already given you the teaching plan of 84 hours. Thanks a lot, sir.